This is gemmacory, level 3 consultation and fitness assessments. Hi Matthew, we're going to be doing a couple of things today. We're going to take some of your medical history and get a bit more detail around your current state of health. Then we're going to have a bit of a chat around your health and fitness goals and what you might want to get from a programme.
Okay.
And then finally, we will do a couple of assessments just to gauge where you are, so we've got a bit of a benchmark as we work through the programme to see if you're achieving your goals. Okay?
Okay.
Any questions before we get started?
No.
Okay, so the other thing to mention is anything that we cover today is completely confidential, and I'll keep all of your data stored away in a safe place, so we don't need to worry about that. So just to start off with, I'm just going to get some personal details. So it's Matthew Cobb, is that right?
It is, yeah.
Okay. And your address is?
5 Shanders Close, Woking, GU21 8SD.
Okay. And how old are you, Matthew?
42.
Okay. So I'm just going to check in on some of your medical history just to understand if there's any risk factors that we need to be aware of. So answer yes or no to these questions. So has your doctor ever said that you've had a heart condition that you should only do physical activity when recommended by a doctor?
No.
Okay. Do you feel pain in your chest when you do physical activity?
No.
In the last month, have you had a chest pain when you were not doing physical activity?
No.
And do you have a bone or joint problem that could be made worse by a change in your physical activity?
No.
And is your doctor currently prescribing you any drugs for your blood pressure or heart?
No.
Okay. And do you know of any other reason why you shouldn't do any physical activity?
No.
Okay. So that's great. That suggests that we don't need to get any more medical advice before you start a programme. Are you taking any prescribed medication?
No.
Okay. I'm guessing you are not pregnant or had a baby in the last 6 months.
No. I'm not.
Have you had any major injuries or surgery in the last 3 years?
No.
Okay. So if you just want to just sign at the bottom here. Thank you very much. Okay, so next set of questions is really just looking at some risk factors. So I'm just going to ask you a few more questions just to identify if there's any other risks that we need to be aware of. So you're under the age of 45, yeah?
Yep.
Have you got any history of heart disease under the age of 55, heart attack, stroke or sudden death in any direct male relative? No? Okay, and so similar, have you got in any first degree female relative under the age of 65 any history of heart disease, heart attack, stroke or sudden death?
No.
No, okay. Do you smoke?
No.
And do you have a sedentary lifestyle? So that would be, are you not participating in any at least 30 minutes of moderate activity at least 3 days a week for the last 3 months?
No, I exercise.
Okay, so you don't have a sedentary lifestyle, okay. Are you classed as obese?
No.
Okay. Have you ever had your cholesterol taken?
Yes.
Okay, and did it come out as high or any concerns with the cholesterol?
No, it was fine.
No, okay. And do you have any family history of high cholesterol?
No.
Do you have diabetes?
No.
Okay. Okay, so there's nothing in there that suggests there's any risk factors that we need to be concerned about. So I'm just going to check in and get your informed consent. So I'm just going to read out a couple of things to you. It might sound a little bit robotic, but I just need to make sure that we check this explicitly. So Matthew, do you understand that knowledge that you consent to perform an exercise programme designed by a trained fitness consultant, and that you understand that exercise will consist of one or more of the following: cardiovascular, resistance and flexibility?
Yep.
That there are potential risks such as episodes of lightheadedness and you willfully assume those risks? That you may stop or delay exercise if you wish, and that you may terminate the session, or I may terminate the session if I observe any symptoms of undue stress or abnormal response. And do you understand that you can ask any questions as we go through, and that you've read and are aware of the medical screening that we go through? Yeah, okay. Okay, so you just want to just sign this page for me. Great, okay, so lots of questions there, so we'll just get that, the medical side of things done. So, so Matthew, tell me a bit about what you want to achieve from a programme, and what we're going to do is we're going to set what we call SMART objectives, and what SMART stands for is specific, measurable, achievable, relevant and time-bound. And the reason that that's important is the more specific we can be about our goals, the much more likely we are to achieve them.
Yep.
So if we look at the short term, so maybe the next 3 months, what might you want to get from a programme over the next 3 months?
I think I'd maybe like to reduce my weight training a little bit. I'd like to lose a little bit of weight, and maybe lean up.
So lean up. And again, just to be a bit more specific about that, so when you talk about reducing your weight training, how much are you doing at the moment?
I do 3 to 4 sessions per week of weight training.
Okay, and what would you rather be doing?
I want to do less weight training and more body weight training.
Okay.
I think.
So, so how many sort of body weight sessions would you like to be doing in a week?
3.
So 3 body weight sessions in a week. And you talked about leaning up. You know, is that about just sort of how you feel physically? Is that weight loss, or?
Yeah, I just want to feel a little bit lighter and a bit more flexible.
Feel lighter and more flexible. Okay, so that's the next 3 months. What about the next 6 months? What might you want to do in that time?
I'd definitely like to improve my posture in that time.
Okay.
I know I do have postural issues, probably because of weight training. So I'd like to do obviously a lot more body weight training, and yeah, just work more on that really, in postural awareness.
And tell me a bit about where you'd like to improve your posture. So where do you find
My shoulders are very rounded.
Okay.
I get a lot of pain in my neck and shoulders, so I'd like to sort of increase the mobility around the shoulders and just release a bit of tension in that upper back.
And then longer term, so next sort of within 12 months, where would you like to be 12 months from now? What kind of goals would you set for yourself?
Long term, I'd like to have lost, 4 or 5 kilograms. And obviously I'd like to be more flexible, more mobile, and then if I can, have some weight sessions incorporated into my training so I can get back some strength.
Okay, and within that sort of 12 months, how many strength sessions would you ideally want to be doing a week?
No more than 2.
Okay. And if you were more flexible and more mobile, how would you know day to day?
Mostly because of my job, because I sit behind a desk, so I can feel those posture issues when I'm sat behind the desk, so I'd obviously like to feel better when I'm sat behind the desk at work.
So feel better. And is that pain that you're feeling?
Not pain, it's just an ache.
Okay. And where do you feel that?
Just in the lower back.
Okay. Okay, so feeling more comfortable when you're sitting at your desk. Okay, and what, sometimes it's great to have goals, but there are things that sometimes get in the way. So what might be some barriers or some things that might sort of stop you from achieving those goals that you need to think about?
I guess injury prevention. So, whatever training I'm sort of doing, I need to be aware that I've been weight training a long time, so I don't want to throw myself into any different training too intensively. So more measured training, really.
Okay. And what about time or lifestyle? The things like that we might need to factor into a programme that we were to put together.
I'd just like to, I'd like to sort of be able to fit my exercise in, and maybe prioritise exercise more, try to train before work, so get some morning sessions in.
Okay. Great. So it'd be good to hear a bit more. You mentioned a few things about your lifestyle, but tell me a bit about the type of work that you do, any hobbies, your family situation. What's more general things about your
So
life?
I do still play football, which again tightens up my hamstrings, etc. So the legs sort of ache. And I do have a desk job, which means I'm kind of sat down for 8 to sort of 10 hours a day, which obviously I can't change because that's work. But I'd just like to be able to sort of work, be able to train and exercise around that with the right type of program, just to kind of make me feel easier sat down posturally, but also still keep up my fitness goals.
And what about family? Do you have family commitments or?
Yep, I've got 2 sons, so obviously we have that time restriction, lack of flexibility, maybe can't train every time I need to or want to.
And when tends to be, so you mentioned mornings before work, is that generally the best time that you have to train?
That's how I like to train, yeah.
Okay. So you touched on this a little bit already, but it'd be good to hear a bit more about your current level of activity. So what kind of training are you doing and how often?
So I do three to 4 weight sessions a week, and then I play football once a week.
And those weight sessions, sort of how long do you tend to weight train for?
Train for up to 1 hour to maybe 80 minutes.
And what kind of intensity are you training at when you're doing those sessions?
So I'll train with hypertrophy, so I will train with heavier weights.
Heavy weights, okay. And what about previous levels of activity? Have you always been weight training, playing football? What's your sort of exercise history?
I've always played football, 25 years or so, and then just an intermittent weight training through those years, really.
And again, the levels that you were playing football in the past, was that how many times a week were you sort of training over the years?
3 times a week.
Okay. But your weight training was a bit more intermittent in the past.
Mm-hmm.
Okay. So tell me a bit more about the kinds of things that you like to do. So what kind of sessions do you really enjoy?
With weight training, I like chest work, back. Obviously I do a lot of shoulders and arms. Don't do a great deal of legs.
Is that because you don't really like to do legs?
I don't really like legs, no.
Okay. And you mentioned you like football, so do you like sort of team sport, or is it the cardio elements that, what is it that you like about that? Okay. What about things that you really don't like, the things that you tend to avoid?
I'm not a big fan of swimming, cycling, not a big fan of running.
Okay. Great. Okay. So, any other things to mention? Anything else that I should be aware of, just as we're sort of thinking about what a program might look like?
No, nothing I can think of now.
Great. Thank you. Okay, so we're going to do a couple of different things now. So I'm just going to take a few measurements from you. So we're going to start. Well, actually, before I do that, we've set a couple of goals, but actually, what we're going to do over time is we'll just keep reviewing that. So it's really important that we don't just kind of leave things as they are now, but we kind of come back as we go through your program and just see how you're doing against those things that you've mentioned. So we'll do that at a regular point. Okay, so we're going to start by looking at your blood pressure.
Okay.
And blood pressure is basically a measure of the blood that's being exerted against the arterial wall. Mm-hmm. And the reason that we're interested in that is that basically is helping us understand what's the workload being placed on your cardiovascular system, and that will help us understand if there's any risk factors for developing heart disease.
Okay.
So what I'm going to do is I'm going to get the cuff, but firstly I'm just going to, if you don't mind, do you mind if I just look at your arm here just to find your artery? Okay, so I'm just going to put a little cross here. So if you could just relax for a second, just sit there for a minute and just put your arm down here. How are you usually about having blood pressure taken?
No, I'm fine.
You're okay with that. So what I'm going to do is I'm going to put the cuff on your arm, and then you'll feel a bit of tightness, which might look slightly uncomfortable. But if you just, as I say, we'll take 3 readings, and then we'll take an average of those 3 readings. Okay. Okay. So we just want to just around there. Okay. Does that feel okay?
Yeah, it's fine.
Okay. Just takes a second to get the reading. Have you had your blood pressure taken much before?
Yep.
Does it usually come back?
Fine, yeah.
It's a bit normal. It's taking its time. Okay. It's taken one, so we'll just leave that for a minute, and then I'm just going to take another reading, and we'll take 3 readings, and we'll just take the average of those 3, okay?
Yep.
So just relax for now. So again, you'll just feel a little bit of compression on the arms, it just pumps through. Perfect, and then we'll just take one more. Feeling okay for now?
Yep, fine.
Okay, so we've got an average of a 129/71, which is within the normal range. So Okay. So now, Matthew, what we're going to do is we're just going to take your height and your weight.
Okay.
And the reason to do that is we're just going to understand your BMI, just to understand if your weight. Sorry, I'm forgetting to take the cover off your arm. That's not good. That would help, wouldn't it? Just to see if your weight is excessive relative to your height. So we haven't got any footwear on, so that's fine. If I just ask you just to stand up against the wall, and I'll just grab my tape measure. Keeps looking forward. You hold that up for me, is that okay? Just keep it facing forward a bit. Okay. Thank you. Yep, so 175. I'm just going to grab the scales. I'm just going to take the weight, if you can just sit on there. Okay, that's perfect. Thank you very much. I'm just going to work out, let's get my calculator. I can just work out the BMI. So weight is 87.3 kilograms. Okay, so that gives you a BMI of 28.5. The ideal BMI is somewhere between 18.5 and 24.9, so it's slightly above the ideal. So again, you talked about sort of getting a little bit leaner, so that might be something for us to think about. Okay, so the other thing actually we're going to do is we're going to now take your body composition. So I have what the scales also do is help us to understand your percentage of body fat.
Okay.
So again, the reason that's important is that the higher the percentage of body fat, there tends to be a higher risk of diabetes or high blood pressure and cardiovascular problems. So that's also good for us to know. So if I get the scales back, feed through to an app on my phone. So let's just there. Thank you. Okay. That's perfect. Let's just step off. Okay. So that is giving you a percentage body fat of around 25%, which is slightly higher than average. So again, something for us to think about as we put a program together. Okay, so any questions about any of those measures that we've taken so far?
No, I'd have expected those results.
Okay, so what we're going to do now is we're going to do a cardiovascular fitness assessment, and it's a step test, which basically is looking at the ability of your cardiovascular system to recover from light to moderate exercise. So what I'm going to do firstly is I'm just going to ask you to sit down, and I'm going to take your pulse with, well, in fact I'm just going to mark your pulse point because I'm going to take your pulse manually when you finish the test. So I'm just ask you to. Move a few things around.
I'll just move this. Just move the tape there.
Okay. I'm just going to move this back a little bit. Make sure that's in a good place. Okay. So what we're going to do, Matthew, is I'm going to ask you in a moment to step up and down to the step. We'll have a metronome which will give you an idea about how frequently to step up and down. So what I'm looking for is a full foot up on the step, and then stepping down. I want you to fully extend the knees and the hips, and also just keep a nice neutral spine, looking forwards.
Okay.
And then you're going to do that for 3 minutes. Okay?
Okay.
I'm going to set the metronome, and what you're looking for with the metronome is a step on every beat.
Okay.
So we'll get into that rhythm first. Just set it, and I'll get the stopwatch.
Okay.
1 second. Okay, so I'll just play it first. Okay, so you're looking for 1 step on each beat. So tell me, I'll just move out of your way a little bit. And then as soon as you finish, I'm going to ask you to sit down on the Fitball and I'm going to take your pulse, okay?
Okay.
Ready to go?
Yep.
Okay. Whenever you're ready. Just get your feet fully onto the step. That's it. We've done 30 seconds so far. How's that feeling? Feeling okay?
Brilliant.
You're doing really well. Okay, again, just keep making sure that your foot fully on the step. That's it. Okay, you've done your first minute.
Good. So it's just 2 minutes left.
Really well. It's now getting a bit hot in here. Okay, halfway through. Well done, keep going. That's it. 2 minutes now, so 1 minute to go. How you feeling now?
Yeah, good.
Feel like you're working?
Oh yeah.
That's it again, just keep your feet well placed on the step, just make sure that they're fully on the step. That's it. Okay, last 30 seconds now, Matthew. That's it. That's it. Keep to the rhythm. 10 seconds to go. I'm going to sit straight down on this football. 5, 4, 3, 2, 1. Okay, great. So if you Okay, so you were in the excellent range. That's suggests you've got a really good level of cardiovascular fitness to start with. So that's fantastic, Matthew. Okay, so we're now going to have a little look at flexibility. And what we're going to do is do what we call a sit and reach test, which is really looking at the flexibility of the hamstrings, the gluteals, and the muscles of the lower spine.
Mm-hmm.
So if I could just ask you to remove your foot there for me. I'm just going to move this out of the way a second. Tape is so. Okay, so you should be nice and warmed up now after that step test, so there's no need to do any more warming up. So if I could just ask you to put your feet in line with this tape here, just your heels in line with that, and just spread them apart a little bit, just so I can put this ruler here. And then I'm going to ask you to, in a moment, just to take a big breath in, and as you exhale, I want you to push this ruler as far as you can forward. Okay, so really stretching out, and then hold it for 1 to 2 seconds if you can. Okay, so whenever you're ready, take a big breath in, and then okay, so when you're ready, we'll do 3 attempts. So if you want to give that one another go. Breathe in and then. Okay. I might have to do that one again to move the ruler before I finish it. So sorry. Okay, so big breath in and then pushing out. And then last attempt, stretching out as far as you can. Brilliant, okay. Okay. So, thank you for that, Matthew. And you can sit back on the fit ball if that's okay. Okay, so that brings you just a little bit below average. Do you feel that you have?
I thought that would be the case. Yeah, the tight hamstrings. Yeah.
Okay, so you mentioned before maybe working on a bit of mobility and flexibility is something that you might want to focus on, that might want to look at in the programme. Okay, so a little bit below average, just something to think about. Perfect. So we're nearly there, you might be glad to hear. It's getting a bit warm in here now, isn't it, after all that work. So we're now going to look at your muscular fitness, so your muscular endurance.
Okay.
So we're going to do a press-up test. And what that is doing is just testing out the muscular endurance of your pecs, your deltoids and your triceps. So what we're going to do is we're going to, in a moment, we'll get down the floor, we'll get into press-up position, and I'm going to count how many repetitions you can do in 1 minute. Okay. And a full rep is down and back up again. And we'll only count a full rep when you're about a fist distance from the floor. So if it's okay with you, I'm going to put my fist underneath. Would that be okay?
That's
and
fine.
Then we'll just check to make sure you're making that depth. And then we'll count to see how many you can do in a minute. Is that okay? Any questions about that?
No. So standard press up form.
Yeah, unless you want to do them on your knees. Which would you prefer?
No, I'll do them off my knees, it's fine.
Okay, so let me just rise. Okay, so I'll just get my stopwatch ready. 1 second. Sorry, Matthew. Okay, so I'm just moving this out of the way. So if you want to get into press up position, and then I say, is it okay? I'm going to put my fist
Yep.
over here, and then we'll count as we go, okay? And we can
Okay.
stop and start if you need to in that time, just as many as you can do.
Okay.
Right, off we go. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22. Okay, bit of a rest, we're nearly halfway through. It's 22, really good.
Okay.
Okay, 23, 24, 25, 26, 27, 28, 29, 30. Brilliant, last 20 seconds. 31, 32, 33, 34. That's it. Let's see how many we can get. 10 seconds left. 35, 36, 37, 38, 39, 40. One more. 41, 42. Excellent, well done, Matthew. Okay, 42. Do you want to sit back down for me? 42. Okay. Okay. So Matthew, that's way beyond excellent. Really can see that your strength training is clearly paying off. So fantastic, well done. Okay, so the last thing that we're going to do is have a look. We're going to do a bit of postural analysis. And the reason for that is, we talked a bit about this already, but in the modern world, we're doing lots of sitting down, we've got quite lots of long periods of inactivity, and that can take its toll on the musculoskeletal system and create poor posture or restricted movement. So I'm just going to, firstly, we'll just look at your static posture, just standing, and then where we've got a bit more space, we'll take the camera outside and we'll just do a little bit of dynamic work. Okay. So if I could just ask you to start with, just to stand up straight for me, just look forwards. Keep your eyes on the horizon, feet sort of hip distance apart. In fact, can you just come a bit further forward just so I can look at you from some different angles? Is that okay? Thank you. Okay, just... So a little bit of rounding of the shoulders. So do you work a lot of chest? Do you do quite a lot of chest work? Okay, so perhaps there might be a bit of opportunity to look at some strengthening of the upper back. Okay, so we're going to now go outside and we're going to do just a bit of walking, some squatting and some overhead reaches. So I might just have to move some things around so we can get out. Okay, so firstly, Matthew, if you could just, actually just in the middle bit here, if you could just walk me in fact, I'm going to move it up here a bit, because it's on a bit of a hill. We'll do it here, Matthew. Okay, so if you just want to come up here, and what would be great, Matthew, is if you could just walk, starting here, just walk me as you normally would. I'm just going to see if there's some different. So I might just do a few repetitions just and again, just keep going until I tell you to stop. Okay, that's great, thank you. So now, if we just come out here a bit, I'm just going to ask you if you could just do a few repetitions of some squats for me. And what I'd like you to do is put your hands over your shoulders and then just a couple of squats again. Just keep going until I tell you to stop. And then finally, if I could just ask you to do an overhead reach. So I'm just going to ask you to just stand again, feet about shoulder width apart, and lift your arms until they're just short, but until they're about right behind the ears. And again, just ask you to do a few of those repetitions for me. Maybe hold it there for a moment, just whilst I'm just.
Yes, I feel quite a lot of tension there when I'm
Whereabouts do you feel the tension?
in the shoulders.
In the
Yeah.
shoulders. Okay.
Same on my squats.
Okay. So what, as you mentioned, what I'm seeing is a bit of rounding the shoulders, a bit of sort of leaning forward in the squat, which suggests that we might have to work a little bit on the sort of strengthening of the back muscles and loosening out some of the
yeah, I could do. Yeah, it just feels really tight in the back. I could do with loosening that back.
Okay, perfect. Okay, so Matthew, I put you through your paces a bit there, so you might be glad to hear that that's it for today. So I'm just going to write this up for you, and then we'll come back. We'll look at a structured program based on what you're looking at achieving and delivering some of the results that we've been talking about. But any questions? Anything that we've done so far? So I think the conclusion is some work to do around mobility and posture, and also practicing maybe a bit of sort of more leaning up, as you mentioned, just around that sort of weight, that
more body weight.
Okay. So any questions?
No, that's good that you pointed out really about my shoulders, because I can feel that when I'm squatting.
Yeah, and I can see that.
I go over, don't I? So
Yeah, you do.
well,
All right,
isn't it?
that's great. Well, thank you very much, Matthew, and look forward to getting started with you. Thank you.